Welcome to the Summit for Wellness podcast, where we help you climb to the peak of your health. And now, here is your host, Brian Carroll.
Have you had a nagging pain in any of your joints? Maybe when you walk or hike, your knees bother you and it makes you sore for days. Or maybe you type all day long at your job and your hands and shoulders hurt or are becoming arthritic. While there are current methods in place to help with some of these pains, such as surgery, which can cause months of rehabilitation, or some medications that can mask the pain a little bit, these methods might not work for every single person. There is another method that has been becoming more mainstream, and it is quite a bit less invasive than surgery. It is called Regenerative Injection Therapy, which encompasses things like stem cell and PRP. What's up, everyone? I'm Brian Carroll, and I'm here to share nutrition and fitness tips to make wellness less complicated. And today we have Dr. Jum Funk joining us to talk about regenerative injection therapies and which ones to choose from for your own injuries. In her practice, she uses 4 different types of injections, so there are quite a few different ways to use these with patients. Before we dive into this episode is brought to you by our friends over at Athletic Greens. I use this greens powder every single day because it helps to get all of those nutrients that you don't think about, like vitamins and minerals, into your diet. It is made from 75 whole food ingredients, which makes the nutrients extremely bioavailable for the body to use. To learn more, go to summitforwellness.com/greens. Now, let's jump right into my conversation with Dr. Jum Funk. Dr. Jum Funk is a naturopathic doctor specializing in regenerative injection therapies to treat orthopedic and sports-related musculoskeletal pain, and she is located in Wenatchee and Bellevue, Washington. Her assessment process includes assessing the tendons, ligaments, fascia, muscles, and nerves, and not just looking at the bones and the joints. The regenerative injection therapies she uses are PIT therapy, prolotherapy, platelet-rich plasma, and stem cell therapy. Thank you so much for coming on to the show.
You're welcome, Brian. Thank you so much. Yeah, I'm honored to be on here today and talk about regenerative injection therapies.
Yeah, and you obviously have a lot of passion for it. So can you tell us what got you so interested in regenerative medicine, injections and therapies, and how did that bring you to where you are now?
Yeah, so I kind of fell into doing injections, period, not just even regenerative injections, but working in physical medicine. I did my residency in Nicaragua, and I graduated in 2007 from Bastyr University. And shortly after, I did my medical residency in Nicaragua doing just more primary care. And I saw lots of patients a day, 20 plus patients a day. But after I came back from my 13-month internship, I practiced up in Bellingham, Washington in a primary care practice. And at that time, my husband fell ill and had a rare health condition. And I said, oh my God, I'm really going to have to make more money here since I'm going to be the breadwinner. And so he was pretty ill. So I basically found a position. So I was doing primary care practice in Bellingham and was commuting to Seattle to work at a clinic in Bellevue doing joint injections. And that was sort of my intro to doing injections in general. And, going through Bastyr and my medical schooling, I was not into orthopedics at all. And but once I was taught how to do the joint injections and trigger point injections, I realized I was really good at it. And I realized that I actually like to do orthopedics, and I got really good at it. And so from there, I went to different seminars, and in one of the seminars, they were just talking about regenerative injection therapies. And that's when I sought further how to learn how to do prolotherapy. And then from there, during that time, people were learning a lot more about platelet-rich plasma injections, and then more recently, stem cell therapy. So Yeah, so I kind of did it out of necessity and didn't realize that I freaking love to do, orthopedics. Yeah, it's my jam. I love it. Can't say enough about it. And in the field of regenerative medicine, it's still the basis of regenerative medicine, is using injections like prolotherapy, which is also a technique. And so you might change the solution that you use when you do prolotherapy. All right, so you can basically use dextrose or saline or procaine or lidocaine along with it, or PRP or stem cells. But the technique of healing patients using regenerative medicine, prolotherapy is, it's like the mother, right? If you have those skills, you can treat so many people for so many different conditions, which I'm sure we'll get into. Yeah.
Yeah, and speaking of conditions, since regenerative injection therapy is so new, what are different use cases for it? Like, what kind of conditions is it good for, and what kind of conditions is it not good for?
Yeah, so a lot of the patients that I have seen, in the last 7-8 years of doing injections in general have been, I would say, knee pain. So osteoarthritis. Osteoarthritis is, some people say, a lot of times patients will come in and say, "Hey doc, I'm bone on bone," and I look at their x-rays and it's not bone on bone. So for those types of patients that have, medium to moderate osteoarthritis, regenerative injection therapies, can be so successful for healing that type of condition. Tendinitis also, any type of sprain, strain. I work with a lot of patients in the extremities, so I do a lot of shoulder injections, so rotator cuff. As long as you don't have a complete tear, then and you've got good hormone balance, your diet is good, you're not doing a standard American diet, you don't have severe autoimmune conditions, then you'll probably be a good candidate for regenerative injection therapies in general. But yeah, so I would say, for the most part, it should be more of one of the first line therapies versus sort of, patients normally come to see me after they've exhausted all the other therapies. I feel like, even before considering cortisone injections, I think regenerative injections should be one of the therapies that people should consider first.
So it's almost like we need to switch the process of that being a last case scenario and put that as a first case scenario, and then you go to these other therapies afterwards if it doesn't work.
Yeah, to sort of change that paradigm, right? I mean, I believe in physical therapy and, I believe in massage, but, I think a lot of people are quick to get the cortisone injection, which can damage your tendons and ligaments if you do it too often, right? It can affect your metabolism. Or because they don't know better, they go and have surgery. I mean, I have several patients in their 30s that have been recommended ablation, where they kind of cauterize the nerve, right? Like in their neck or their low back. And I said, you have to get a second opinion because you're in your 30s, you're so young. There's all these other therapies to consider before, doing surgery. I'm not anti-surgery. It's make sure that, there are all these other therapies that you can consider before going to surgery or doing something like, a nerve ablation where they actually burn and cauterize your nerve. Yeah.
So can you talk a little bit about the different therapies that you do and what makes them different from each other, since there's like 4 different injection therapies that you do?
Yeah, so I do a lot of different therapies, but yeah, those are the 4 main ones, Brian. So when a patient comes in, like for example, knee pain, I have lots of knee pain patients, right? And they could be, from ligament issues to, partial meniscal tears to osteoarthritis. I normally treat them very similar in terms of starting them off with like perineural injections. And perineural injections are injections with 5% dextrose. So it's all natural. And I work on the superficial nerves. So I'm bathing the superficial nerves and I'm calming down the inflammation that are in your nerves that lie right underneath the skin and above your muscles. So in essence, I'm trying to improve the fascia, right? The nerves that are lying in your fascia to decrease inflammation in that whole, joint space, to decrease inflammation in your ligaments, tendons. So that's usually my first line therapy. because a lot of times patients will come in and say, hey, Dr. Funk, I just have knee pain and it's just this whole area. So it's really hard for me to go in and like do specific injection, right? So I found that in clinical practice, seeing hundreds and hundreds of patients with knee pain, that I'll start with perineural injections, which is the least expensive of the regenerative injection therapies. And a lot of the times I'll get their pain down 50, 60%, and then it hones in to specifically where their pain might be. Like it might be, okay, it's actually a joint capsule issue, or, oh, it's, definitely their MC, the medial collateral ligament, that's the issue. And so, yeah, I've just found that for me, at least as a practitioner, I tend to go to perineural injections first, get their pain level down, and perineural injections are pretty immediate. It's very diagnostic. So if someone comes in and I do the injection and their pain goes down immediately, then I know, okay, it's probably neurogenic, meaning that the nerve is probably causing some of that pain. And then once a lot of that pain goes away, then I'll go towards more like prolotherapy. Okay. And then if I'm doing 2 to 3 rounds of prolotherapy where I'm using a higher percentage of dextrose, right? So with prolotherapy, you're using, for me at least, I mix dextrose with lidocaine or procaine, and I'll inject it into, mostly the ligaments, the joint space, and sometimes the tendon. And then if I'm doing 2 to 3 rounds of the dextrose prolotherapy and patients aren't better, then I'll actually go to PRP, or I'll go to stem cell therapy. So this isn't cookie cutter medicine, right? Like each patient comes in with, potentially similar complaints, but you don't ever treat them the same because their body biochemistry is different. Right. And then their symptoms are different. Their biomechanics are different. So, and that's one thing that I do in their initial assessment is to see, okay, you have knee pain, but, is it due to instability? Is it due to, tight muscles pulling on your kneecap? Is it, so yeah, I mean, I think that having good physical medicine skills by looking at the biomechanics, by looking at their gait and postural assessment is also huge in figuring out what's going on. So,
how do you determine whether you do PRP or stem cell, and what's the differences between those two?
So with PRP, so PRP is platelet-rich plasma, and that's where I would draw someone's blood, spin it down in a centrifuge. So we're in essence taking out, the red blood cells, the white blood cells, and we're concentrating platelets down to 5 to 7 times more concentrated than what's typical, and we're trying to mount a modulated inflammatory reaction. So a reaction that typically normally occurs in the body anyways to start the healing process. And for those conditions, again, if they have tendonitis issues that are chronic, if they have, more moderate to a higher grade of osteoarthritis, I'll typically start with the PRP. And then for some patients, if I am doing a couple rounds of PRP and they're improving, but they really want to regenerate like the cartilage tissue, then, oftentimes I'll move to the stem cell. Or I'll start with stem cell and add the PRP along with it. So for me, at least, in practice, whenever I do stem cell therapy, I also add in the platelet-rich plasma as well. And so, and it all depends on the patient. Sometimes I'll do a PRP first, I'll do the stem cell and then a PRP after, or I'll do stem cell with PRP and then just one PRP after. It all kind of depends on patients' finances, and then it also depends on, the patient's health condition and level of injury. So, yeah, that's why having a good practitioner to really give you a good diagnosis and be able to really treat the pain generator is so important in whether a regenerative injection therapy is going to be successful or not.
So earlier you were saying that PIT therapy is pretty quick to get a response, so you can see what's going on there. With PRP and stem cell, is the response as quick? Like the reduction of pain, is it as quick as PIT therapy, or does it take a lot longer?
Yeah, so yeah, it's interesting. It differs for different people, right? So you're talking about, regeneration of tissue. Okay, so when you have injury and I'm doing regenerative injection therapy, say, for example, platelet-rich plasma or stem cell, right? I am in essence I'm injecting, PRP or stem cell, which is going to activate, growth factors and cytokines and other, anti-inflammatories like interleukins and yeah, so those types of chemicals in the body will signal your tissues to repair and regenerate itself. But it takes a long time. So it can take, 4 to 6 weeks for you to feel something, up to 3 months. Some people will notice, not much change during the first couple months. And then the third month, comes around and they're like, wow, yeah, I mean, my mobility is definitely much better. And then for stem cells, sometimes even up to a year, patients will notice that they'll see changes, 6 months to 9 months to 12 months out. And it all depends, again, on the patient itself. I just know that, with perineural injections, trigger point injections, and prolotherapy, patients will notice, especially with PIT therapy, they'll notice it, that day. And then prolotherapy, they'll notice it within a few days to weeks.
Yeah, I've heard from some people that have had stem cell therapy on their knees before that they didn't really notice anything, and then all of a sudden, months down the road, they go to do an activity and their knee doesn't hurt. So it sounds like it's a slower progression for that one, and you don't
Yeah.
really notice the slow things because it's not immediate. It's just little
Yeah.
changes every single day.
Yeah, because I mean, imagine every day if stem cells were not working for you, right? Like I think you would die within probably a few hours, right? So every day our stem cells, we're generating stem cells and then stem cells are dying, right? I think it's by the age of 50, you're making 50% less stem cells, right? And so it also depends on age. If you tend to be older, right, your stem cells are not regenerating at a faster rate than someone that's younger and more vital. And so, yeah, it does take time, right? And so it also depends on what they're eating, how their hormones are like. So, anytime someone asks me, how do you optimize, Dr. Funk, what can I do to help like the stem cells? You just injected me and I paid you a lot of money. What else can I do to help with it? And I say, yeah, your diet and your lifestyle, your stress management, like those all help, to improve the extent of your healing process. And healing of tissue does take time. It's relaying these tissues that have been damaged and injured for so many years, right? And so, when those cells, like those stems, if those stem cells and those anti-inflammatory markers and cytokines, they're all signaling molecules. So, if those aren't around, your healing potential isn't going to be as great. So making sure that your internal biochemistry is optimized is so important for regenerative injection therapies. Yeah, that's why I'm pretty picky about who I see as a patient in office. If they're not as healthy as they could be, I give them valuable information on what they can do to change their diet, change their lifestyle, start exercising, and it really does help. I mean, I am all for optimizing your body's, internal, biochemistry before actually doing injection therapies.
So, when you're doing stem cell therapy, when you're extracting the stem cells from a person, is that part painful or is it just like going in and getting a shot of some sort?
It's definitely uncomfortable. But I do numb, patients up. So it's, it's a small cut and I use a cannula. So it's a cannula that I, introduce intra-abdominally and, I extract the fat out. The whole procedure takes about an hour from the start to the end where I'm also doing the PRP injection and also the stem cell injection. But it's an in-office procedure, right? So but it is like a minor surgery. So, patients do have to be careful afterwards in terms of, just laying low and taking it easy and, not jumping into the hot tub because we don't want to introduce any bacteria into the incision. But yeah, the incision is very tiny, maybe the length of your pinky nail, right? And so, but it is, when I'm, introducing the cannula and I'm sort of sucking out the fat, it's pressure. Patients tell me I definitely feel that pressure. And but we do numb you up, and so there is discomfort, but I feel like getting injections in general without being numbed up is probably, sometimes can be uncomfortable as well. So it all depends on like how much pain tolerance you have, I guess. But, no one's ever fainted on the table or anything like that. And I don't do it for patients under anesthesia. They're completely awake. And so, yeah.
And then when you're doing the injections, are you relying on the natural healing capabilities of the body to make sure that it's healing the correct tissues and not regenerating tissues that shouldn't be there?
Yeah. So again, for example, adipose-derived stem cell therapy, I'm creating sort of like a fat graft. It's almost like, a little bed for the stem cells to kind of grow on, right? So you do your best by injecting into an area. So normally, like I said, I do it for knees and shoulders. It's really hard if you're doing adipose-derived stem cells, you have to dilute it so much if you're doing it into like an Achilles tendon or a wrist, which I've done before. It's just really thick, right? And so you inject the stem cell into the area that you want to regenerate, right? But again, it's all about the cell signaling molecules. Wherever there's inflammation, that's typically where the cells are going to go to repair itself and to regenerate. So we do our best to get it into an area. And again, when you're injecting into the knee, you're injecting into the joint capsule, right? Into the joint itself. So, we have no ability to exactly say, go here, right? You can inject it, close to the area, but it's going to receive the signal to go where there's a lot of inflammation and where there needs to be repair. So our bodies are extremely smart that way. For example, if you're doing an IV infusion of stem cells, usually it's great for patients with COPD, for example, because, first pass goes to the lungs, right? And so again, it goes to wherever there's inflammation. And for COPD patients, for example, it's typically, your pulmonary, your lung area. And so you do your best to inject in the area that the patient has pain, and it could be the tendon, the ligaments, or the joint space. And the body sort of has repairing mechanisms and processes that tell the cells basically where to, repair and regenerate.
Awesome. And a couple months ago, there was a summit that they were focusing on stem cell treatments and just providing a lot of different information about the different types of injections that you can get. And they had mentioned at one point that right now there's no known side effects of stem cells other than it just doesn't work. And so it's a pretty safe type of medicine that you can use for orthopedics and other parts of the body. Is that what you have found as well in your own practice, or have you noticed any kind of side effects that could potentially happen?
Yeah, so I think, Brian, with any type of procedure, right, and even, a cortisone injection procedure, there's always a risk. So you have to be mindful of who your population is. Again, if someone is immune compromised, I am not going to be, taking fat necessarily out of their bodies and re-injecting it back, like into a joint, for example, because again, you're relying on your own body's natural healing mechanisms, to fight for you, right? To repair, to help you, repair your body. So there's, to me, there's always that risk. And so so for them to say there's no risk, I don't know about that, but I know that you can minimize risk by, having the patients optimize, their diet, their lifestyle, making sure that, when they are having these therapies, they don't have, the cold or the flu. So their immunity, right, their immune system isn't compromised for whatever reason. And then I know that, recently in the news that, some umbilical cord stem cell companies have had adverse reactions because of, bacteria in the, I think it was bacteria in the stem cells. So yeah, I mean, you as a physician in general, whether I do regenerative injection therapies or not, you have to definitely be sure that, the patients that you work on, making sure that in the aftercare, like the post-procedure care, if you're doing a lot of injections, which we do in prolotherapy, they're not going and swimming in the ocean, or they're not going in a hot tub, because any of those, injection sites that you do, can potentially, cause infection, right? The risk is very, very extremely minimal. But again, you want to make sure that, you minimize the risk for the patient.
And since you mentioned you probably wouldn't do it on someone that's immunocompromised, if someone has multiple autoimmune issues and you take their stem cells and then re-inject it into their body, are they more likely to have their immune system try to attack those stem cells instead of allowing it to do the healing work that you were hoping it would do?
Yes. So, yeah, I mean, that's the thing. Some practitioners, they swear that, for example, doing IV infusions would help with very difficult conditions like cancer patients and patients with like ALS and whatnot. I just don't work with that population, so I don't have clinical stories to tell you in regards to that. I just know that, when it comes to regenerative injection therapies, if you're using your own stem cells and your immune system is already compromised, I would imagine that, your ability to heal is not just going to be as strong as someone whose internal milieu is really strong, right? Like their vital force is strong, their ability to heal is strong. So I know that some patients have gone to use, umbilical cord stem cell for that reason, right? So they're using umbilical cord stem cells that have gone through, a lab that's certified with the FDA, and so the reaction, the protein and the leukocyte reaction, of putting another substance from another person into your body, there's no cross reaction, for example. And maybe that might be a better avenue versus like actually, getting stem cells from your bone marrow or from your fat, right? Does that make sense?
Yeah, it does. Yeah, for sure. Thanks for clarifying that. So another question I had for you is, like you mentioned earlier, that with PIT therapy, a lot of times you can get like 60% reduction in pain. And then you might go on and try these other therapies afterwards. What would be considered a success in most cases? Would like 80% or better pain reduction be considered a success, or are you looking for the pain being completely gone?
Yeah. So there was a study for prolotherapy. I think it was, I'm pretty sure it was for low back pain. And what they found was that for the patients in the study for low back pain, 85 to like 90% of the patients had that percentage of improvement for prolotherapy, right, for low back pain. If you think about low back pain surgeries, right, I think it's like 50% of low back patients, get improvements. And I don't even know if it's 85 to 90%, like, the study did with prolotherapy. So, for example, if you're just looking at studies, that's one study that is really telling in terms of a low force therapy like prolotherapy being extremely helpful for a condition. But yeah, so for me, I want patients to not have pain. Like if you have pain, there's something going on, right? And I just noticed that with perineural injection therapies or PIT therapy, patients not only have less pain, but they have better mobility. It's the first line treatment that I use for patients in motor vehicle accidents that have, do not have the ability to like rotate their neck very well or have good flexion or extension. For example, it's because you're using only 5% dextrose, and dextrose is sugar rod, right? And in essence, that dextrose helps to downregulate the TRPV1 receptor, which basically just means that you are decreasing inflammation in those nerves. And nerve pain can cause, it can be pretty debilitating for a lot of people. And it can also cause lack of mobility, right? And so if I'm wanting to see, a patient have sometimes the quickest improvements, perineural injection therapy is one of the therapies that I use, because even on the first visit, like sometimes patients will get better 30 to 40%. Like I go in, I do the injections, and if I work on someone's neck, for example, I do usually their neck and their shoulders. And you're looking for specific superficial nerves that are potentially causing that pain, right? And so, and then sometimes I'll mix the perineural injection therapy with trigger point injections, right? So I'm working on the superficial nerves and the muscle to improve the mobility and to improve, and to decrease their pain. When I am trying to improve someone, like, again, I'm looking for like 80, 90, 100% where there's just no pain, right? And I would say, my average visits are probably 5 to 6 visits, whether it's a combination of perineural and, a cup of prolo or prolotherapy and a cup of PRP, or it could just be like a few trigger point injection visits, with 1 to 2 perineural injections. It all depends. Like sometimes, for a patient, I'll say, oh, I think you need, 4 sessions of prolotherapy, and I do 2 sessions of perineural and a couple trigger points, and they're done. Like they're like, I'm in good enough, I feel like my pain level's down enough where I can mountain bike, I can downhill, and I'm fine. So doc, I'm good. And I think my success rate has been extremely high because, again, it comes down to knowing what your pain generator is, like what is causing that pain. It's not always, having, decreased meniscus, right? It doesn't always mean that you're going to have pain. Like a lot of the decreased meniscus is actually due to instability in your ligaments and tendons. And so if you treat the ligaments and tendons, you're going to have better stability, in your lumbar, vertebrae, in your neck, in your shoulders. And so a lot of when patients come to see me, a lot of it is actually education. They've never heard of prolotherapy before. They've never heard of perineural injection. And, some of them think it's a little woo-woo, but once I start injecting, and they're like, wow, I have better mobility, like in just this one visit, they become a believer. And it's always awesome to see that. Yeah.
Yeah. And I would think the level of success is also dependent upon the patient itself too, what they perceive as success, because someone that's coming in with a pain level at a 10 and then they leave and it's down to a 3, that's a huge success for them. And you as a practitioner might want to see that down to a 1 or a 0, but for them, their whole life has just changed.
Yeah. And it's so common, Brian. I have patients come in and they say, Dr. Funk, like I heard about, stem cell therapy and I want stem cells, and I do a physical exam and I say, you know what, let's start with PRP, or let's just start with these nerve injections and see where we go. And, by the end of it, I make less money and they are much better. And I think in the end, that's being ethical, right? And, I always tell the patients, sure, your friend must have gotten better with just 1 stem cell injection, right? But, does that mean that you can translate that to your care? I say no. And so, some patients, they do get disappointed that I don't put them on stem, that I don't do the procedure right away. But, after years of practice and knowing what works, I try to go with the least aggressive treatments, the least expensive, least aggressive treatments, and sort of work my way up. All right. It's my job to give the patients what I believe, my best medical opinion of what's best for the patient. And, once in a while, stem cell is the first line therapy because, their osteoarthritis is pretty darn severe. And then there's times where, there are patients where they're just so far gone that, they do need that surgery, right? But there's also things that I can do in the aftercare. So, perineural injections, again, if you're getting, surgery, I mean, they're cutting through your fascia and your skin. So I can help in the reparation process in the aftercare. So I also explain to patients, if you do have to have surgery, there's lots that regenerative injection therapies can help with in the aftercare. And I think surgeons are now getting, or some orthopedic surgeons are, they believe in PRP, right? Platelet-rich plasma. So they're actually injecting it while they're doing the surgery to help with the healing process so that the patient's, aftercare, their healing is going to be that much better. So.
Yeah, and I definitely see how doing this before going to a chiropractor or physical therapy could be a really good option too, because you're lowering that inflammation level. So then these therapists can go in and do what they need to do to be able to get the body aligned the way that it needs to be, or get the tissues to move the way they're supposed to, which will help them to stay healthier for longer too.
Absolutely, Brian. And that's the beauty of referrals, right? And so, I'm starting to make a name for myself here in Wenatchee and Leavenworth, and, building the trust of the physical therapists around here. And that's the thing. I think that the reason why a lot of times physical therapy does not work is because they are in so much pain. And it's when you're not treating the pain generator and you're walking patients through, these great physical therapy exercises, the patient is in so much pain, they're guarding, right? So if I can even get their pain down 30, 40% in a couple of visits and then send the patient back to physical therapy, there's just going to be so much better range of motion. There's going to be better circulation to the tissue. It's just going to be a more effective and efficient physical therapy visit. And I think that, and maybe it's because physical therapists, some of them don't know the different options that regenerative injection therapies can do. But I think that type of cross referral is great. And I'm starting to do it a lot more here in Wenatchee as well. And I find that it's beneficial for the patient, by far.
Let's talk about costs a little bit, because you talked earlier that it does cost money. So at this point of this recording, do insurance companies cover any of this, or is it all cash-based right now?
Yeah, so it's all cash-based. So I run a fee-for-service clinic where, patients come and they pay for the procedures as well as the visit. And so sometimes, I'll do courtesy billing just for the visit, and it depends on whether the patient's insurance will reimburse them for the visit. But yeah, anytime that you're using dextrose or PRP or stem cell, insurance does not pay for it whatsoever. And, in some ways, being in private practice and having my own practice, it's so rewarding, and I feel more carefree in what I could do because I'm not, being held to the, restrictions of insurance companies, right? And I have been working with insurance companies for many, many, many years and seen, how detrimental they can be to my treatment plans that I want to work with the patients. Even to authorize, trigger point injections for a patient, in pain was, pulling teeth. And so I can't even imagine them trying to authorize injection therapies like, PRP, for example. And, there are so many research studies on the effectiveness of prolotherapy, yet, why does insurance companies not, allow this is, beyond me. So, in some ways, I kind of like that this is hands off on insurance, because the practitioners that are doing these regenerative injection therapies can, we can do what we find is most effective for the patient, and, tell them, based on your symptoms and, your signs and symptoms, this is what I recommend, and this is what we should do, instead of like the insurance company saying, to authorize you to have just one PRP or just, 3 prolotherapy sessions, or so I think that, I enjoy having a private practice and, here in Wenatchee, and I will probably remain, having a fee for service practice.
Yeah, that's been one of the big talks in the medicine world, is just how, a regenerative injection therapy can do so much for people. However, insurance isn't wanting to pay for it. And it's like insurance would rather pay $100,000 for a surgery that, $1,000 of injections could help with.
Yeah, I mean, it boggles my mind.
Yeah.
And, patients say, oh my gosh, your PRP is so expensive, or your stem cell is so expensive. But if you think about the cost of you being in pain and going to how many chiropractic visits and how many physical therapy visits and time off that you've had to take because you were in pain, and not having a good quality of life, it adds up monetary, right? And so I try to explain to patients, it's what you prioritize. If you want to be out of pain, it's, yes, it is, you have to pay up front, but at the same time, I can get you better. Like, these are, this is what you need to do to regenerate your tissues. This is what's going on. And so I think that being in a cash, practice, a fee-for-service practice, my patients are dedicated. If I tell them, okay, we got to fix these hormones, we got to optimize your testosterone, your thyroid, so that, you can have better healing for your ligaments, tendons, like, they'll do it, right? Because they are paying up front. They are investing in their health. And we pay, I have to get a new phone, and I'm paying $700 for a new phone. That's as expensive as a PRP, as a platelet-rich plasma for my knees. And so it's it's all about perspective, right? And what you prioritize, and what you find that you can't live without. And for a lot of my patients here, I love them. They are active, and they want to stay active. And some of them come to me for preventive. Like, they're like, I'm not in that much pain, Dr. Funk, but I want to be as good as I can for as long as I can. For example, I have a patient, he's a CrossFitter, and he had a big Baker's cyst in the back of his knee. And I did 2 rounds of Perineural injections on him. And he's like, I have no more pain. And I said, great, but I'm going to send you to your primary care to get, for them to remove the Baker's cyst with aspiration. Come back, we'll do one prolotherapy, and then we'll call it good. And he goes, great. I want to do it because I want it to be preventive. Like, I don't want it to come back. And I said, okay, this is what you're going to do. So, and, like I said, it all comes down to patient's dedication and priority, right? So.
And just like you said, you're paying $700 for a phone that lasts maybe 2 years if you're lucky, or you can use that to make your body feel better for a decade or 2, if not longer. So it is all about perspective on what's most important to you.
Yeah. And, one other thing, Brian, that I have to say, one other thing that I would have to say in my practice is that I really try to get patients to, be active, right? For example, a lot of doctors will say, okay, do these injections, and, you can't use your use your joints very much. And, for me, unless you're, I would have to say a caveat would be something like prolotherapy, where, you kind of have to lay off for a couple weeks. But in general, I practice what I do, several times a week is functional patterns training. And I'm a big, championeer of people really trying to build more muscle and be active and have better mobility, whatever it is, and to have good tensegrity, right? Like, in their muscles, and because that's going to translate to good tensegrity in the ligaments, tendons, and their joints. Because hypermobility is one of the reasons why so many patients are in pain. And explaining that to a lot of patients that are really flexible, I think that growing up, in gym class, if you were super flexible, it was like a really good thing, right? But as you get older, again, the basis of a lot of prolotherapy treatments is that these ligaments, they become injured and they become lax. tendons as well. And so all of that instability, leads to degeneration and degradation of, the joint space and the bones as well. And so, if you're exercising, you're having good, tension in the myofascial slings appropriately, you're going to walk better. You're going to have better posture. It's so important, to do regenerative injections, but also to have that active part, be part of the treatment plan as well. So.
Awesome. Well, as we close up here, do you have any final things you want to talk about when it comes to regenerative injection therapy? That's got to be the hardest word to say ever.
Yeah.
Add in any last thoughts that you might have.
Yeah, being active, I can't imagine not being able to be outside in the sun and enjoy all the activities that I do. So, I'm part of some of the Facebook groups, and some of the things I see on Facebook is that people will use ibuprofen prophylactically before their long hike. And it's one of the worst things that you can do for your body. So, when I'm talking as an orthopedic specialist here, don't do that. There are, if there is something going on, right? Try to figure it out. Go to a regenerative medicine specialist that can really do a good physical exam and figure out what to do. And sometimes it's as simple as, if you have plantar fasciitis, right? It could be doing a few trigger points in the areas of like your the muscles, like your gastrocnemius or your soleus. It could teaching patients how to do myofascial release with the lacrosse ball. So there's lots of things to do instead of just masking it with like taking ibuprofen, which they've known to decrease the healing of fractures in general. So I want people to be active, but also to be smart about, what they are doing and taking in order to be active, right? And so and the other thing that I wanted to say about regenerative injection therapies is, I specialize in orthopedics, but I also, anything with a needle, I love to do. So, in practice, it's mostly orthopedics, but I also do, for hair restoration, for PRP aesthetics and PRP hair restoration as well. And so there's many benefits of regenerative medicine, right? I specialize in regenerating, tissues, and, tissues can be from your skin to your hair to the joints and ligaments and tendons in your body. So yeah, it's an ever-changing, ever-evolving field, as we talked about earlier, Brian, but I love it. It's great.
Yeah, it's just like any other health subcategory within the health world. Everything's evolving and changing, which makes it just so fascinating, which this is one of those topics that, people are talking more and more about. So I'm glad that you have been able to come on and share all this with us. My final question for you is, do you have a morning routine that you do every single day that helps just prepare you for the day and keeps you as healthy and as active as you possibly can?
Yeah, so my routine is not the same every day, but I would say 2 to 3 days out of the week, at least the weekdays, which to me is Monday through Thursdays. Half of the time in the mornings, I'll have a cup of coffee, and I usually don't do breakfast. If I do breakfast, it'll just be like a hard-boiled egg. But I actually take my dogs out. I have 2 Rhodesian Ridgebacks, and man, they are a handful. I usually take them out and go down to the Forest Service roads or Tumwater Canyon or Icicle Creek, and I'll let them loose and we go hiking. So I get some exercise and hiking in that way. But a lot of times, I love my sleep. So sometimes I'll sleep in. Sleep is so important for tissue regeneration as well. And then sometimes if I am not out hiking with the puppies, I'll actually have my coffee, and I love to read. Right now, I'm like totally into the Outlander series, the books by Diana Gabaldon. And so, after that, I am, have a full day of work. And then my workouts, which I do many times, after work is I do my functional patterns training at home. I do a lot of bands and kettlebells, and that keeps me strong. I mean, I'm 100 pounds and sometimes I'm carrying, 30-pound plus packs. And so for me, being able to be strong and stay strong in my 40s is definitely extremely important. So so I do try to get my exercise in, but that's usually, I'm more of a after work exerciser. So that's usually my routine.
Awesome. Sounds like a great routine. It sounds very similar to some of the things that I do to stay in shape for backpacking and hiking and all the fun stuff that you can do around where you live. Okay, so people can find you at drfunknd.com, and you're also on social media. What channels are you on there?
Yeah, so I'm on Instagram, and you can find me at The Funky Jum. Jum. And then I'm also on Facebook. You can find me at my med clinic, which is Funk Regenerative Med Clinic. Yep. And then I also teach other doctors how to do regenerative injection therapies. And I work for a company called One Living. And my friend and colleague started that. And if you're a nurse or doctor that's interested in regenerative injection therapies, you can email at connect@oneliving.center. And that's where to find me for the different varieties of social media aspects.
Great. Well, thanks again so much for coming on and talking about regenerative injection therapy. And as this whole world starts to evolve more with just more information coming out about what this can be done with, we'll definitely have to bring you on to talk more about it. So thank you so much.
Oh, you're welcome, Brian. Yeah, I feel so honored that you guys asked me to come on, and it's been a good time. I love talking about it.
Well, there you have it. As you can see, there is a lot more to regenerative injection therapies than just stem cells. Stem cells is the one that we hear about all the time, but there are other options that you can use for pain and for orthopedic issues that aren't as expensive as stem cells. So if you find someone that works with regenerative injection therapy, they will be able to guide you in which injections to start off with first. So if you're local to the Washington region, then check out Dr. Jum Funk. She's a great option around here. But if you're not in Washington, then feel free to look in your own areas to find someone that you trust and someone that can guide you in the best possible ways. In the show notes, we'll have resources to the Healing Miracles Summit that I talked about. That's all about stem cells and a lot of information diving into those as well. So go to summitforwellness.com/73. Next episode, we have Greg Gerard coming on to talk about brain health and different ways that the brain controls how the body functions as a whole. So a lot of times we hear about gut health and how important that is to our overall health, but we also need to talk about how the gut and the brain are both connected in order to make the body as healthy as possible. So here is a little clip from my conversation with him. We are joined with Greg Gerard, who is a nutritional therapy practitioner. Hey Greg, can you tell us one unique thing about you that most people don't know?
I had a career beginning shoulder injury.
Tell us a little bit more.
I'm an avid whitewater kayaker, and I injured my shoulder. I tore my rotator cuff in 2010 and couldn't kayak for a year. And I didn't need surgery, and I PT'd it and yogaed it as far as it would go. And I had to change the way I was eating. I had to heal my gut to fully heal my shoulder. And that led me to becoming NTP.
And we talk a lot about that in the beginning of our episode together. So in our episode together, can you tell us what we are talking about, what we're focusing on?
Mainly how it's great that we're focusing on the gut and healing the gut, and that's crucial and always will be. But the gut feeds the brain, and how we need to also look at if the brain needs some nourishment. If the brain if the gut feeds our heart, our bones, our brain, our endocrine system, if the gut feeds everything, then in our gut, most of our gut has been off for decades, possibly generations, especially with gut flora. Then, how could our brain not need more neurological support through certain nutrients that typically aren't even in the healthiest of diets?
And speaking of nutrients, what are some of your favorite foods or nutrients that you think everyone should get in their diet?
I'd say, I talk about the gallbladder a lot. So some type of gallbladder support, that will help the brain because the majority of the brain is fat. And so being able to emulsify our healthy fats that we're eating, that's a big part. And I see a lot of people, it's best to always to test, but I see a lot of people test really well for pituitary and hypothalamus glandular support. So that would be in a tablet or capsule.
And then what are your top 3 health tips for anyone who wants to improve their overall wellness?
Top 3? Let's see. I'd have to say go give yourself some grace and go easy on yourself. But still, just know that it's not all self-discipline and willpower, that some of our physiology and neurology, and then maybe even, the majority of the body is bacteria, some good, some bad. So just know that our cravings a lot of times are being dictated by bacterial and or fungal overgrowths. So go easy on yourself and just know that it's not all completely, totally about self-discipline and willpower. That we have to kind of go to somebody that can help guide us through our health journey, and that has a vast background in anatomy, physiology, neurology, and maybe a little bit of psychology in there too. I would joke that there's a lot of therapy and nutritional therapy. I don't know if you'd say that was one thing or that was 50 things. That was more than 3 probably.
Awesome, Greg. Well, we have a great interview for everybody, and they can listen to it next week. So Awesome. We'll see them then. Now, if you have not left us a rating and review, please go to your favorite podcast listening option and leave us a rating and review. They do help the show to get in front of more people. So if you can take a couple of seconds out of your time to do that, that helps us out tremendously. Keep climbing to the peak of your health, and we will see you next time.